Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for both their acute and chronic medical needs. We do this through our Amazon best-selling book, Vitality. We do it through our primary care, COVID-19 vaccinations, COVID-19 testing, as well as concierge and telemedicine. Good afternoon, everyone, and welcome to Let's Chat. Today, we're going to be talking about the top 4 benefits of having controlled blood pressure. I thought that this would be a good topic for us to share on a topic that we sometimes, blood pressure is something that we sometimes don't pay enough attention to and or can never bring enough awareness to, especially in terms of prevention. So let's start off by talking about the benefits of having controlled blood pressure. So this is something that's beneficial, especially for those of you who may be out there that have family history of high blood pressure. I know that I do. And so there are so many benefits to paying attention to our blood pressure and making sure that it is controlled. So let's start off. Number 1 benefit, obviously, having great heart health. People that have controlled blood pressure have great heart health, typically. People that have hypertension are 3 times more likely to die from heart disease. So having controlled blood pressure is something very essential to preventing heart disease in those individuals. And the activities that you go through to help lower your blood pressure, keep it controlled, are the same activities and the same tips that we'll give at the end that help to decrease your risk of having a heart attack or having a stroke. And anyone that has a history of high blood pressure definitely needs to regularly pay attention to their blood pressure, it being controlled in relation to heart health, okay? Second benefit of having controlled blood pressure is that you have a decreased risk of stroke. Whenever you have uncontrolled blood pressure, you can actually cause blood clots to form in the arteries that lead to your brain. This can block blood flow and therefore can cause you to have a stroke. All a stroke or heart attack is a lack of blood flow to that part of tissue, organ, so to speak. So if you have a lack of blood flow, and remember, our blood flows, flows from our heart through our arteries to organs to help perfuse them, to help bring oxygen and nutrients to them, right? And that's a lifeline for those tissues. So if you have a decreased oxygen flow to a certain part of the heart, that can cause you to have a heart attack. If you have a decrease in oxygen flow, or blood flow rather, and therefore decrease in oxygen and nutrients to that portion of tissue in your brain, we call that a stroke. So having controlled blood pressure also helps to decrease your risk of stroke. Okay. The third benefit of having controlled blood pressure is that you help to protect 2 very important organs. Most of us have 2, and that is your kidneys. Your kidneys are one of the organs that we sometimes forget about, or sometimes we don't think about in terms of, if I have uncontrolled blood pressure, how does that affect different organs? We talk about how it affects the brain. We talk about how it affects the heart, but we sometimes don't think about, hey, you know what? Me having uncontrolled blood pressure can damage your kidneys, and this can happen over a period of time. With uncontrolled blood pressure, arteries around the kidneys are narrowed, weakened, or hardened. And in that state, they can't deliver those same oxygen nutrients that we're talking about that your blood delivers in an artery to that kidney tissue. And when that happens, those kidneys get damaged when they don't get proper blood flow, right? Damaged kidneys do not filter blood well. One of the main functions of your kidney is to filter your blood and remove toxins from it, right? That's the main job of our kidneys. So you hear people talk about people that have kidney disease or that are on dialysis. Most of the time, this is because that person has undergone some sort of damage to their kidney, or their kidney doesn't function or filter as well as it should. Therefore, they're reliant on machines typically to do this filtering for them. And when people are on dialysis, they typically have to be attached to a machine about 3 days a week for the machine to pull out those toxins from their blood supply, which is the job that their kidneys normally would do. Okay, so having controlled blood pressure helps to protect your kidneys so that having kidney damage, end organ kidney damage as a result of uncontrolled blood pressure does not happen. So having controlled blood pressure helps us to protect our kidneys. So that's the third benefit. And so if you'll notice here, those first three benefits that we talked about deal directly with the flow of blood from your heart to these very important organs, our brain, our heart, and our kidneys, right? Right. So very, very, very important for us to have controlled blood pressure so we get nice, even blood flow. Having controlled blood pressure also means that you have great circulation. And that means that these organs, you're less concerned about them getting adequate blood flow. Okay. Fourth benefit of having controlled blood pressure is increased quality of life and increased life expectancy. And untreated blood pressure increases your risk of death, especially if it's to the tune. A lot of times there are patients that come in and say, oh, I've had this blood pressure, I've been watching my blood pressure. And most of the time you can go, if you don't have a blood pressure cuff at home, which I typically recommend that my patients, that's something that you get and have at home, so that if something's going on, you can easily monitor your blood pressure and make sure that it's controlled. Now, and when you do that, let me just say this. Number one is make sure that you check with your physician. Prior to that, this advice does not undo the advice of your personal physician. Let me say that at first. But what I will say is that if you have a blood pressure monitor at home, make sure that you've taken it into a visit with your physician so that they can check it with the arm cuff, because that is the most accurate blood pressure check that you can get. But you just want to make sure that your machine is correctly monitoring your blood pressure and that it's what we call calibrated well. Okay. So just take your blood pressure cuff into your visit. They won't mind, and they'll just check the blood pressure cuff and check it with your machine that you have at home at the same time, just to make sure it's calibrated well so that then we know that the numbers that you're getting are accurate. Because as you talk to us and tell us about what your blood pressure is running, it may help us in determining what may be going on with you if there's something going on. So having controlled blood pressure helps to increase your quality of life, increase life expectancy. People that have untreated blood pressure, especially when you have a blood pressure that's 180 over 100, we get concerned about that level of blood pressure. And the first thing we get concerned about is you having a heart attack or a stroke. Uncontrolled blood pressure like that over the period of just 1 year can increase your risk of heart attack or stroke by as much as 70 to 80%. So very important to make sure that we're controlling our blood pressure and over a period of time. So let's talk about some of the tips. So what are some of the things that we can do to help us keep our blood pressure control? The first is, if you have family history of high blood pressure, please, 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 if you don't have a blood pressure cuff at home, go buy one. Omron is the brand that I use the most and that I recommend that my patients get. Most of those monitors are typically very, very accurate. Again, make sure that you take it in for that check with your physician to make sure it's calibrated properly. So monitoring your blood pressure over a period of time, especially if you have family history of high blood pressure, and you can never be too young, because I've had people in their 20s and 30s, oh, I don't worry about that blood pressure, I'm only 20 or 30. Well, unfortunately, there are 20-year-olds and 30-year-olds that have heart attacks every day. So we want to make sure that if we have family history that we're monitoring it on a regular basis so that we know at what point that we need an intervention of some sort or that we need to do something different, right? Right. So one of the things that we can do, so the number one tip that I would have for you to do is, number one, making sure that you're monitoring your blood pressure. You checking your blood pressure when you go to your physician once a year, which I hope you're going more than once a year, at least a couple of times a year, especially if you have family history of high blood pressure, is not as accurate or will not catch it as much as it will if you monitor it at home. If you're monitoring it at home, because I know when you come and see me, I'm going to ask you, I'm going to say, hey, have you been checking your blood pressure? What has your blood pressure been running? If you don't have a blood pressure cuff at home, you can always go by a fire station. The members of the fire department across the entire nation are phenomenal. They will gladly, happily check your blood pressure for you if you live in or near a firehouse. They will always do that for you. Urgent care clinics are in the same vein. And I know that at my office, we're not an urgent care clinic, but we do handle urgent care matters. So we'll always check blood pressure for a patient that wants to come by. So monitoring that blood pressure on a regular basis, number one, top tip to help controlling blood pressure. Number two is going to be exercise. Did you know that people that exercise on a regular basis have, there are at least 13 different studies that I've seen that confirm that people that exercise on a regular basis have an increased life expectancy at minimum of 0.8 up to 6.9 years. So that means that people that exercise on average have an increased life expectancy of about at least 3 to 4 years compared to their counterparts. So there's a lot of benefit you get from exercise. It helps to relieve stress, which we'll talk about that in just a moment. But it increases your life expectancy. So having a regular exercise program, very, very vital and very, very effective for people that have family history of high blood pressure. The sooner you get an irregular exercise regimen, see your physician, find out, hey, do I have high cholesterol? Am I diabetic? Making sure that none of those things apply to you. But getting a regular exercise regimen, again, a way to help for you to be heart healthy. Okay, so that's exercise. Number 3 benefit is going to be, we've got to control stress. So whenever we get stressed, we release what are called fight and flight hormones, adrenaline and cortisol. Okay, whenever we get stressed out, those hormones are immediately, your body produces it, a surge of it actually during a stressful situation. These hormones temporarily increase your blood pressure, and they do that by increasing your heartbeat or your heart rate, and then your blood vessels narrow, and therefore it increases your blood pressure temporarily. Now, they don't have studies that show this, that you having these stressful situations repeatedly increases your blood pressure over a long period of time. There are no studies that confirm that. However, you having, and it depends on how often this fight or flight response is triggered in you. If you're having a continuum of stress on a daily basis with the release of these hormones, that means your blood pressure is shooting up, it's shooting up, it's shooting up every single day. That is not something that's healthy for your body. So the best thing we can do is find some modalities that help us to control stress. So one of those things is, number 1, making sure you're getting enough sleep. Number 2, making sure that you have a source for dealing with or outputting that stress. Exercise is a great one. One of my favorite ways to help reduce stress is through exercise. You actually release hormones when you exercise that actually help to calm or bring down those stressful hormones or that stressful situation. It actually releases happy hormones when you exercise. So another thing that helps with stress, I know it's one of my favorites and my go-to, is meditation and prayer for me. Meditation, prayer, relaxation techniques, something that helps to just allows you to let go of whatever stress is weighing on you, because mental stress does have its effect on you physically. Okay, let's make sure that we're in realization and that we fully grasp that whatever is going on with you mentally or wherever you are mentally, it can affect what's going on with you physically and can affect your blood pressure, especially over a long period of time. So a lot of things that help in addition in relieving stress, spending time with your family and friends. And we're around our family and our friends, we are supporting one another, encouraging one another. And so that's a way to help to decrease stress as well as the exercise, which we already talked about. So again, those 4 benefits of having controlled blood pressure is that you have great heart health, decreased risk of stroke, helps to protect your kidneys, and increased life expectancy and quality of life. So, ladies and gentlemen, that's all I had to share. Thank you guys for tuning in. Hi, Miss Jones. Thank you for joining us today. Hi, John. Thank you for logging on. Hey, Carmen. How are you, cousin? Signing in from Chicago. So thanks a lot. Does anyone have any questions? I hope everyone's having a great Sunday. Anyone have any questions? Any questions at all, especially about blood pressure? No questions? Okay. So I do want to take this moment to share with you guys as well. If you have not had your annual exam with your physician, I know that we have my cousin who's in Chicago. Ms. Jones, I think, is here in Birmingham. And John, I'm not sure where you're logging in from, but if you've not had your annual exam with your physician, please make sure that you do that. We're going into our technically second year in the United States that we've had cases of COVID in our nation, but the third year we've been dealing with and talking about the coronavirus. So in that vein, I know that a lot of people miss their regular visits in the last year because of what was going on. So I want to take this time out to say, if you have not gotten your annual exam with your physician, please make sure that you do that. There are regular screening exams that we need to make sure that everyone has, especially if you're a diabetic, if you have a history of heart disease, if you have a history of high blood pressure. And just for general screenings, for women, our mammogram, pap smears, we need to make sure, and bone scans, need to make sure that those are all up to date. Colonoscopies for men and women, we need to make sure that those are in place. And then for, we talked about men, women, for men, we need to make sure that your PSA has been checked. We need to make sure for everyone that your kidney and liver function has been assessed, making sure that if you need to have your cholesterol screened, you've had that screened. If you have a history of vitamin D deficiency, we definitely want you to make sure that you have that screening. I just want to caution you guys with that, because I know over the last year we've kind of been in, and as we're still surging currently with that Delta variant here in the state of Alabama, I just want to make sure that people don't forget to make sure that you follow up on your annual exams, okay? I'm sure that your physicians have a way, I know that we do in my office, of trying to make sure that you are safe when you come in for those annual exams. I know that we're doing some testing of our patients prior to them entering the building if they're there for an annual exam or physical. Okay, anyone have any questions? Hey, pretty Barbie, how are you? Happy Sunday. That's all I had to share with you guys. Again, if you are, oh, Miss Jones, you're in for Greensboro, Alabama. I don't know why I thought you were here in Birmingham. So thank you for logging on. Hello to you guys down there in Greensboro, Alabama. Anyone have any other questions? If you're not vaccinated and you are within in Birmingham or surrounding area and wanting to get a vaccine, we have Pfizer and Johnson & Johnson at our office. You can give us a call for that. We also are doing COVID testing. We do that on the outside as well. We do not do that in the office. So if you're in need of one of those things, and let me just take this as a reminder to those of you that have chronic or regular seasonal allergy flares, if you're having those symptoms now and you think, oh, it's just my regular allergies, please make sure that you see your physician or see someone to get tested to make sure that's all it is, especially because we're in a high transmission state here in the state of Alabama with the COVID-19 variant. COVID-19 Delta variant of COVID-19, yes. Okay, so that's all we had to share with you guys. If you're in need of any of those services, you can reach us at, as well as for primary care services, you can reach us at 205-291-8842. That's all we had to share. Happy Sunday, everybody. Hi, Ms. Gaines. Thank you so much for tuning in. I hope that you guys stay safe, and I hope that you are vaccinated. I hope that you're using your mask when you leave your home. Using your mask when you leave your home, especially going out in public areas, especially if you choose to be inside of a building for any services like dining or anything of that nature. Okay, that's all we had to share. I hope you guys have a happy Sunday. Bye-bye.